Hello everybody, my name is Dr. Tran. I'm a chiropractor. I provide chiropractic service, acupuncture, physical rehab, cupping, nutritional advice, and other stuff. My goal overall is health and wellness. So today we're going to talk about elbow, treatment, elbow, wrist, and we especially tag it on cupping. We did a few different cupping video on different part of the body like shoulder, knee, back. But today we focus on the elbow. But before we start with the treatment, we have to understand why we do the treatment and how it works. So let's talk about the elbow real quick. The muscle that help you moving your finger, all of them actually come from the elbow out. Okay, so we have 10 finger, but we have 9 tendon that go through here and control the finger. But from here to here, mostly it's tendon, because tendon is almost like a rope. It makes 1,000 of little fiber come together. So the tendon attached to the bone. The muscle attached to the tendon, okay? So the tendon doesn't change its length, but the muscle does. Well, how does the muscle change length? Well, the only way your muscle works, contract and relax, right? When the muscle shortening, it allows you to contract. And then when you're done using it, unlock it, the muscle go back to its normal length. Now, for you to contract the muscle, you have to have energy, ATP. But to unlock those muscles, you have to have electrolyte, like calcium, magnesium, potassium, okay? But that's why it's a vicious cycle. The tighter, the more you use the muscle, the more lactic acid build up. At night when you sleep, your body should get rid of it. But sadly, because now we use a lot of computers and phone, it's micro movement, right? So if you go and lift weight, if you lift 20 pounds, right? You cannot do that unlimited. You might do set at 10 or 20 and then you have to rest. You don't have any more strength. But we can type for a long time. So with the typing, it doesn't look like it's strenuous, but it's continuous. And that's why you can do a lot longer. But because you can do a lot longer, that's why you don't realize the amount of lactic acid accumulate is tremendous, because you use it without having time for the muscle to rest. So over time, that's why the muscle get tight. And when the muscle get tight, it puts pressure on the tendon and start yanking on the bone. And so a lot of people have elbow pain here on the outside. Well, on the outside, the elbow called this lateral side, called lateral epicondylitis, meaning tennis elbow. Well, most people play tennis have pain, but you don't have to play tennis to have pain, because every one of us using our hand all the time. So the inflammation on the outside called tennis elbow. And then the inside is called golf elbow. Same thing, because golfer going this way, tennis go the other way. But same thing, the outside is called the extension, meaning you extend your wrist up this way. Inside flexor, flex your wrist this way. So when you move your arm this way, you see the flexor, but it also extend. Okay, so most of the pain from the elbow, and that's only from the arm down, from the shoulder down, from elbow up, is you have tricep and other muscle as well. But basically this whole joint here, when the muscles are tight, you're rubbing on it with abnormal friction. Just imagine you drive your car would have your hand break up. You know, you can still drive, but the engine hit up faster, the brake went out faster. That's what happened with muscle tightness. You know, we use our hands so much, but we rarely ever stretch them, right? The tendon are designed to last a lifetime. They're very strong. But because they're very strong and they make most of that fiber, and then you can see in the pictures here, you look here, you can see how most of the tendon are white. You see the muscle are red because the muscle have direct blood supply. They heal much faster. But on the other hand, tendon doesn't heal very well. So it takes a long time for you to damage the tendon. But when it damage, it takes a long time to heal. Okay. So today the cupping, we actually attack the muscle. So when the muscle have a lot of lactic acid build up, they get tight. So when you do the cupping, we put the suction cup in here. We pull out the muscle. You see this fascia here that separate one muscle from another. So when lactic acid build up a lot, the muscle and the fascia got stuck together. So when you do cupping, we suck up the muscle. We pull it up into the cup. It break up the adhesion. So it allow the muscle to loose up, but also allow the blood vessel within them flow better. So now let's talk more on the cupping. So as you can see here, we have different type of cupping set here, but this is, I have to clarify, this is air cupping, okay? This is not fire cupping. And as you can see in my model here today, you can see there's a little hairy here. So the cupping doesn't work as effective, but for the demonstration purpose, it's worked right now. But I have quite a few of my patients have to shave off the hair just so that the cup can stuck better. But you can see if I palpate his arm, you can see it's pretty tender along here, and it's also pretty tight. Yeah, so we're gonna cup the area that we can actually access, and the cup will stay on. All right. With air cupping, we normally put some oil, ointment, or you can put medical ointments, or in this case we have olive oil mixed with ginger oil. And so right now we're going to focus on the extensor first, and because the top here is the extensor. And if you palpate, you can feel different area. There's more tightness there. Okay, and then the next one right here, see right above, below the elbow crease. Yep, and make sure you pull them tight enough so that they actually stay. So I'm just use this, because this actually better cup here. But since you have enough room, yep, so that was cup. And usually I would do the top as well, so a bit of the above the elbow here. Yep, right there. And then a little bit on the tricep right there. I'll tell you the cupping, because it's the hand so round, it's usually a lot more pressure, so you might feel more pain. But yeah, so basically that's half of the extensor cupping that help with the elbow tendonitis, and even work with the carpal tunnel as well. So this just basically hold this for 10 minutes. Now it might came out prematurely, which is fine, but let's do that for 10 minutes. And you guys can see here, we have a close-up on the, you can see the discoloration start changing, because that's that pull out the lactic acid. With some couple already fall, but it is okay. But if you actually get in close up, you can also see later on, you can see the pore actually open up to pull out more toxins out of the cupping. So it looks gross, but trust me, it's very effective. All right, so here we are. So after roughly 10 minutes, let me get the towel real quick. All right, now, so after we did 10 minutes of the cupping, if you get closer look, you can see how, see the skin starts to change color. So this is where the lactic acid is. See, with the cupping are the same, you can see how there's darker here, there's lighter here, and then same thing in different area of the arm. So you can see this arm right here. See, there's darker here, it's not as dark there. And same thing here, okay? And then the inside of the elbow, same thing, there's more darker here and not as much there. So that's tell you where more lactic acid is. I'm gonna start off right here. Right below the elbow crease. There we go. Yep, you can see here the cup along. All right. There you go. So after 10 minutes or so, we take it out. And same thing, you can see the discolorations, some area more or less. And then usually on the arm, you might have the feeling that it is swollen, and maybe it is swollen because it's the elevate, but it disappears within like an hour or two. Yep, there you go. So you look like this, you see how tight the arm is. Yep, so that's the cupping. We focus a lot on here. And it's not gonna do just one treatment, but you can do maybe couple times a week. And the more you do it, it's softer. But at the same time, while you do all this treatment, you can see now, stop there. With the elbow, you also have to take some extra supplements, like electrolyte, calcium, magnesium, potassium, vitamin C, vitamin D. Because just like we're fixing a house, we need to have raw material, right? When your body do some healing, they need to have raw materials. Yep, so as you guys can see, that's the example of cupping for the elbow. And I know we all can use cupping on the elbow. And if you do it 2 or 3 times a week, it definitely make a difference. Now remember, this is not replacing any kind of medical treatment, right? It's just helping when you can't get to a doctor, you can't seek help, then you can manage to do it on your own. So I'm hoping this video will help. So if you have any questions, comments, please put it below, and anything else you'd like to know. We're more than happy to accommodate your requests, but just give us some comment below. All right, thank you for watching. See you next time.